Good afternoon. I'm here today to talk about advancing health equity in the city of Chicago. We live and work in one of the world's greatest cities, but also one that has been tormented by persistent health inequities. As case in point, today, the average non-Black Chicagoan can expect to live 11 years longer than the average Black Chicagoan. And in our classrooms and in our research, we talk a lot about the importance of focusing on the root causes of health inequities, things like social determinants of health and structural racism. But putting these lessons into practice has been very challenging. To their great credit, the Chicago Department of Public Health in 2021 developed and began implementing the Healthy Chicago Equity Zones. At its core, this initiative recognizes that at least some of the root causes of health inequities can be mitigated by sharing power with and providing resources to those communities who are most negatively affected by health inequities. Chicago has invested almost $30 million in creating an equity zone infrastructure that involves direct partnerships with over 50 community organizations representing all 77 neighborhoods of Chicago and multiple sectors, and they're organized into 6 geographically delineated equity zones, each with an appointed lead organization. These zones have been provided funding according to need, as well as other resources and training to conduct community health assessments, use the data to come up with health priorities, and then develop and implement neighborhood-level interventions to address those priorities. Our team from the Division of Community Health Sciences at the School of Public Health were tasked with carrying out an initial evaluation of this program. Our evaluation focused on providing information for program improvement and sustainability. It was guided by a community advisory board, and it involved qualitative and quantitative methods. So far, we've found very promising evidence that these equity zones have indeed been effective at building capacity within communities to address some of the fundamental determinants of health inequities. Examples that we have found include over 600 new or strengthened partnerships among community organizations within the equity zones. Over 90% of the organizations involved have reported that they've developed useful new skills for addressing health inequities in their communities, and over 85% have reported growing levels of trust with the city of Chicago. With the strengthened capacity, these equity zones, have established that behavioral and mental health, public safety, and chronic disease are the key priorities in Chicago, and they are in the process of implementing neighborhood-level interventions to address these priorities. Importantly, though, it's worth noting that all of this work has relied on federal funding, which is now at risk, and so there's a real concern that sustaining this progress that's been made and even preventing the erosion of this foundation that has been built is a real concern. Thank you.